You fix the loose rugs, you did the leg exercises, but you are still falling. Why? It might be the chemicals inside your system. You might be taking what we call FRIDs or false risk increasing drugs, and you don't even know it. Today, we are going to audit your medicine cabinet and fix the head rush that makes you black out. Hi, I'm Dr. Lim. Many older adults are on a cocktail of medications. Individually, they may be fine, but mixed together in an aging body, it can be explosive. In Geriatrics, we use the term FRIDs. It stands for false risk increasing drugs. Before I list this, listen to me very closely. Do not stop taking your medication today, because suddenly stopping a medication can be more dangerous than the fall. The goal of this video is to empower you to ask your doctor the right questions. Here are the 4 types of medication that commonly cause falls. I call them the sedatives, the relaxers, the rushers, and the confusers. The first are the sedatives, namely sleeping pills, anti-anxiety medication, or even strong drowsy cough syrups. They slow your brain down. If you trip, your brain is too asleep to tell your hands to catch you. You hit the ground before you wake up. The second category are the relaxers. Certain painkillers or muscle relaxants, they take away the pain, but they can make your legs feel like jelly. If your legs give way, you fall. The third category are the rushers. Basically water pills for your heart or blood pressure. They make you need to go to the toilet badly to pass urine. The fall doesn't happen because of the pill. It happens because you're rushing to the toilet in a panic. You run, you trip, you fall. The fourth category are the confusers. Basically medications for allergy, itchiness, or some stomach cramps. In older adults, this can cause confusion or brain fog. You aren't sharp, you lose track of your movement. I can't review your medication through YouTube, but you can do this. I call this the plastic bag review. And here's how you do it. Take every pill that you eat, hospital medication, pharmacy medication, vitamins, traditional herbs, and dump them all into a plastic bag. Bring that bag to your doctor on your next visit. Put it on the table and ask, "Doctor, are any of these making me dizzy or increasing my falls risk?" You might be surprised how often you find a drug that you don't need anymore that is silently hurting you. Now is the head rush, or the medical term is postural hypotension. Do you ever stand up from a sofa and feel your vision go black? Or feel like you're floating? Imagine this bottle is your body. When you lie down, blood is everywhere. The brain is happy. When you stand up, gravity pulls the blood down to your feet. Your heart should pump harder to shoot that blood back up into the brain. But as we age, or if your blood pressure meds are too strong, the pump is too slow. The blood stays in your feet. The brain goes dry and you faint. I will do a full deep dive video on this later because it involves salt and hydration and a few other measures. But for today, we use the sit, wait, stand rule. First, sit on the edge of the bed. Then, wait for 1 minute. Palm your ankles up and down to squeeze the blood out. And thirdly, stand slowly. Give your engine time to start before you drive. So, we have covered the body, the environment, and the chemistry. If you fix these 3, you have solved 90% of the puzzle. But what if someone falls because they simply forgot to use their cane? Or because they wandered out of the door looking for a home that doesn't exist? That brings up the most difficult topic, dementia and behavior. I will tackle that in a future video. I'm Dr. Lim. Stay safe, and I'll see you in the next one.